CoolSculpting works by freezing the fat cells. And it takes about an hour per site to freeze them down to 0. That induces something called apoptosis, which is programmed cell death for as many as 22% of those fat cells. Not more than that, but as many as 22%. The fat cell dies, it releases as fat, it's picked up by the immune system and excreted via the liver. It has very similar feel to it after, as does liposuction. It's hard, it's numb, but unlike liposuction, when I had mine, I went out and hit golf balls and lifted weights immediately afterwards. There is no anesthesia. There are no pain pills. You know, liposuction is pretty good, but you know, you got anesthesia and you're going to have some, feels like you worked out real hard, and some people even think it hurts. CoolSculpting has none of that, but you're only going to get 22%. Whereas liposuction, you're going to get 80, 90% of the fat you want to get off. No incisions, no anesthesia, no recovery time, but 22%. And if you do it twice, and you can do that, you could do it a week later and do it a second time. Mathematically, you can get 40%. And this is how it does it, is what we talked about.
Is there any lasting effect to that, or is that all based on how your intake?
It's permanent fat removal. So if you put on 10 pounds, yeah, you're going to get fat, but you're going to get fat in other areas, just like liposuction. Because the fat cells aren't there to receive the fat in your, say, tummy. So because they can't go to your tummy and you put on 10 pounds, they're going to go someplace else. Hips, breasts, you know, back, someplace.
You pick where you want it to go.
The only way you can do that is if you treat all the areas except one, then it has no place to go but that one area. And that actually happened on a lady. We did tummy and hips and inner thighs and outer thighs and knees. She put on 10 pounds and went to her chest and her bottom, and she was thrilled. Serious, true story. I need to get that picture. I don't know if I can remember where it is. If you do your tummy, it's an hour. Now, there are fancier ways to do your tummy where you do right side and left side to try to sculpt it, and then it's still 1 hour per site. You can do the inner thighs for an hour, but you got 2 inner thighs, you got 2 hips. The cool thing about it, though, is if you come in and say, on your lunch hour, you only got an hour, you do 1 hip. You can't do 1 hip in liposuction, that'd be crazy, but you can do it in this and come back a day or a week later and do the other side. I mean, it's very scalable, and you can do it multiple times. So this has a place, I think, for people who are never going to, I mean, okay, show of hands. How many people in here have fat that they don't want? Yeah. You know, how many people are going to have surgery? Maybe 1 or 2. I was that way. I mean, I got fat on my tummy and my hips. Do I want it gone? Yes. Am I going to have liposuction? Nah, probably not. Would I do CoolSculpting? I've already done it twice. You know, it's a no-brainer, and it's less expensive than liposuction. Not the gold standard, but it's got some pretty cool things. Okay, there's a guy. See the fat? Less. Is that 22%? I don't know, but it's reasonable. You know, and he did 2 hours and read a book on his iPad. You know, how easy is that? Or watched a movie. Look at those inner thighs. And now there. Pretty good. No scars, no anesthesia, no downtime. Nice. Bra strap rolls? Better. Not gone. 22%. Keep doing it. That's one. Yeah. Look at that. And you know, the other thing it does is that people get fired up. Like they can see it in their clothes, and they get fired up to do more diet and do more exercise, which, by the way, is the best. It's a kickstart. And, you know, if you took the money you spent on this and really were hardcore in diet and exercise, it'd be the best. That'd be better than this. But that's really hard to do. And this is, we got a lot of people who are in very good shape and can't get that little bit off. And they love this because they keep working out constantly. There's no downtime, and it's really good for them. Look at that. You know, she's still got some weight to lose, but not as much as there. Look at that. These are our results.